To open the clinic module in the separate window tab, so we will get the clinic module here. Now click on the clinic link module from the left side menu to get all the available sub modules and links. Now the first is OP consultation. So from here, the doctor can get the list of registered patient. Just selecting the clinic. First of all, I have registered one patient in cardiology. So just selecting the cardiology, as per the rooms the doctor is sitting, they can select their room and click on the next button. So they will get all the registered patient in room number 4. Currently, only one patient has been registered. We have registered in the room number 4. So their queue number is also coming. So all the list of patient we can see from the clinic also. So from here, just we have to select the patient for the further treatment by clicking on the select link. Then we will get the detail of the patient, like their UHID, the name, the gender, the age, and date of registration. If patient is new, then the new checkbox will be checked. If the patient is taking the follow-up, then the follow-up checkbox will be checked. Then, 3-way we can register the patient in clinic. Also, before that, we can capture the vitals of the patient, like height. It can be done by the clinic boy also, and the body temperature, and just click on the save button. So 3 vitals we can capture. Now we will discuss about these 3 registration methods. The first one is register and create access health record. Using that button, the doctor can register the patient in their clinic, and the system will redirect on the order entry advance page. In the case, suppose that the doctor wants to give some test for this patient, then they will prescribe some medicine after seeing the reports. In this case, they can use the first registration button. So they will get directly after registration, the system will redirect on the order entry advance page, from where they can order the investigation. The second one is escape registration and create access health record. In this, suppose that the patient visited in the clinic and doctor seen that the patient not belongs from their clinic, then they can skip registration and give some tests. In this case, if using this button, also the system will redirect on the order entry advance page without registering the patient in cardiology clinic. The third one is only register patient to clinic. If doctor wants to capture the details of the patient, like the complaints of the patient in detail, then they can use this third one option, only register patient to clinic. In this, using this button, system will not redirect on any page. But once we will go for the treatment sub module, on every link under that module, we will get the same patient, not need to search again. So just I will show you using the first one link, registered and create access health record, in which by default system will redirect on the order entry advance page. We will get one registration number. Now the system is has been redirect on the order entry advance page. From here, the doctor can view the previous generated report of this patient using the lab consolidated report button. Here we can get the all previous results lab wise. We can search Like 3 labs, we have the biochemistry, microbiology, and pathology. And also using the date filter, we can get the previous done report. In analytical form also, the comparison also we can get here. If the same test has done multiple times, so we can get the comparison also, comparison statistics also here. Then we can order the services by selecting the category and just clicking on the investigation. All the investigation category will reflect in the drop down. Like just I want to order some biochemistry test, so we'll get the biochemistry test in this list. Also, if you have created the package like the liver function test, the plasma glucose, we will get the package also. So not need to order single service. Just by clicking on the arrow button, all the sub tests of this package will be ordered. And also we can order the single test. We can search the service name, and by service code we can search the services. Just I will give one single service, albunium. And if the doctor is logged in with their ID, their name will be selected by default, not need to select again. So it depends on the designation. So if the user designation is as a doctor, then their name will be selected as a recommended by. Just need to verify observation medicine. We can give the remark here, overall remark that can be seen by the lab technicians, and click on the save button. After saving, verifying the order, we can get these options to print the requisition slip. So 3 way we can print the requisition slip. Department wise, like for biochemistry, for the microbiology, and for pathology, separately we can print the requisition slip. We can print the consolidated requisition slip, or we can print the barcode. Let me show you the format of the requisition slip. So this requisition slip contains all the details, the like requisition number, UHID, the patient demographic details, and order investigations, and the department and the doctor name who have prescribed the investigation. Same, we can print the barcode also if needed. And we can get the consolidated requisition slip in this format. So as per the requirement, we can use the requisition slip. Otherwise, we can skip it also. By default, using the UHID, the lab technician, the sample collection user can get all the order detail. So also we can use the paperless service. So we have ordered the investigation. So any other investigation also we can order, any procedure we can order from this order entry advanced page, like OT procedures. So it depends on the patient conditions, and just verify the order service. So this way, if we have used the first button to register the patient in clinic, we will get this order entry advanced page by default. Other than using the last one, just register the patient in clinic, we can capture the patient condition in detail under the treatment module. Just after click on the presenting illness, by default the registered patient, the current registered patient will be selected here. So not need to search the patient again. So we can capture the complaints here, complaints can be captured in codification. So we can use the here we are using the SNOMED city complaints. So we can search the complaints from the SNOMED city. Like in the case of pain, we can get the suggestion drop down here: pain in ear, pain in lips, pain in tongue, etc. So as per the complaint of the patient, we can search the complaint and we can select from the suggestion drop down. Doctor can give their remarks on the complaint. And also they can set the parameters complaint in the different part. Like for presenting illness, we can set the different parameters as per the requirement. Like here, I have created one parameters, stomach pain. Under that, we can create multiple parameters. Like left abdomen, painful stomach, we can create the drop down value. So just need to select it. So as per the requirement, doctor can create the parameters for their own clinic. So it will, using the less effort, we can capture the patient conditions. Then just click on the save button. By default, the current date will be selected by the system. Then how to configure the parameters for this for these links? So from here also doctor can create it. Just click on the configure a specific template. From here we can get the selected clinic on which we have registered the patient. So not need to select the clinic. Just we have to select the purpose. Like we want to add the parameters under general examination, which is or under the complaint and under the history tab. So just we need to select it. Then group wise we can add the parameters. First of all, we have to add one group that will reflect in this drop down. Like I have created one stomach pain group. Under that, I have added the left abdomen. So how to create the groups? Just click on the add new groups button, type the group name and click on the add button. The added group will reflect in this drop down. Now, before adding the headers in the group, we have to select the group first from the drop down. Then we can add the header name under this group name, just clicking on the add new header button. So here just we have to enter the header name and click on the add button. The header will reflect then in this drop down. By selecting the header, we can set the parameters type here, the event, the findings. These are the types by default we are able to select it from the drop down. Then need to enter the parameter name. After entering the parameter name, then we can give the control type for capturing data. We can use the checkbox. We can use the text box. We can use the text area if you want to enter large data, large text. Then we can use the text area. We can use the sensitivity drop down for just a plus minus, and we can use the dynamic drop down by separating the values through comma. So it becomes a drop down value. And then click on the save parameters. It will reflect under the cardiology clinic. So this way we can add the parameters. It will help to capture the details of the patient under the clinic. So now from next tab we can capture the history also. History can be captured from SNOMED city directory. Like surgery, if patient have any surgery history, So I will type the surgery. All surgery related suggestion will appear in the drop down. We can select the values from the drop down. So not need to type all the things. And also it is a free-handed. We can type the history also and give the remarks and click on the save button. So under the presenting illness, the doctor can also able to view the all available previous complaints and previous history. So now I have captured the history. So history, previous history is also coming, and also it will show the date of capturing the history and the username who have captured the history. Just clicking on that link, it will show whatever details we have captured with the date and time. So using the Snowmat city, I have captured the details. So previous surgery to be vagina. So that are coming here. Also the remarks is coming in the bracket. Same we can see for the complaints. So from here the doctor can view the previous captured details. Now the next is physical examination. Under the physical examination, we have a three types of examination. Like we can do the general examination, we can do the systematic examination, and we can do local examination. In all three tabs, we can get the we can search the examination using Snowmat city codification. So from here, whatever vitals we have captured while registering the patient in clinic, that are coming by default. For other vitals, we can capture the details like the BP, we can capture. Also, time-wise, we can capture the vitals of the patient. The respiratory rate should be less than or up to 45. Then the pulse rate of the patient, heart rate, and height. According to height and weight, we can capture the examination by using the Snowmat city directly. Using the another examination method like systematic examination, we can capture the examination detail. Also, we can add the parameters for systematic and local and general examination one by one. Suppose that for systematic examination, if I will type pain, So we can get the suggestion drop down. From here, we can able to select the values, pain assessment. We can give the doctor can give the remarks, or any nurses can enter the remarks, whatever remarks provided by the doctor, and save it. If we have created the parameters, then the parameters will reflect here. Now, the same we can do for the local examination. From here also we can capture the detail of the local examination, like pain relief or any other. So as per the word we have typed, we can get the suggestion drop down. And give the remark. So these fields are optional. So as per the requirement, doctor can just capture the presenting illness. They can skip the physical examination. If they want to do the physical examination, they can capture the physical examination detail. So we can see all the previous details, like the whatever general examination we have done, we can able to view the details here. The previous systematic examination details we can view for this particular patient. The previous local examination we can view here. So it will help to treat the patient. So all the previous EHR, whatever details we have captured under the clinic module, that can be visible patient wise. Then the next link is allergens detail. If patient have any allergic detail, allergy with the medication, with the food, with the environmental and the bacterial, we can capture here with the value of mild, mild to moderate, moderate, moderate to severe, severe and fatal. Just by clicking selecting the checkbox, we need to select the values from the drop down. If patient have any allergens, then medication allergy details we can add here. If the pharmacy is running under the hospital, then we can get the drugs name from the pharmacy also. Whatever drugs name we have added, that drugs name will be reflected in this list. We can select the drug name, or also we can type the drug name here. It is free-handed. And click on the save button from the bottom. So we can get the message saved successfully. Then the next link is diagnosis. We are using here two compliance to capture the diagnosis of the patient using the SNOMED CT and ICD-10, International Classification of Disease. Using the 10 version or using the SNOMED CT, we can capture the diagnosis detail of the patient. So how to capture the diagnosis using the SNOMED CT? Just we have to type the diagnosis detail here, like fever, so we will get the suggestion drop down here. All the fever related diagnosis we can get here. So just need to select it. Fever of the newborn, fever after vaccination. So according to the patient condition, we can capture the diagnosis. Just after selecting the diagnosis, by default, the logged in user will be selected in this drop down. Not need to select again. Now we need to mark this diagnosis as provisional or final. So it depends on doctor. If the reports are positive, then we can mark as a final, or if suspective, then we can mark as a provisional. Then click on the save button. So all diagnosis detail we can get in the respective list here under the diagnosis detail. Also, we can print the diagnosis, or we can delete the diagnosis from the list if any wrong entry has been done by the doctor and by the nursing staff. In the case of COVID patient, we can mark the COVID patient as a suspected or we can mark as a confirmed patient, COVID patient. Another way, using the ICD-10, also we can capture the diagnosis. So here, locally we can search the ICD code 10 or from the WHO site, we can get the latest ICD-10 code. By words, we can search locally the diagnosis, ICD diagnosis code. Like for fever, if I will type fever and click on the search button, so all fever related codes are available locally that will reflect here. Or by ICD-10 code, also we can search the codes and their definitions. So we can select the fever unspecified and we have to mark as a provisional or as a final diagnosis and click on the save button. So this way, if we are capturing the diagnosis, so we can get the reports of the patient diagnosis wise. So two diagnoses we have done here. Now we can go for the directly also we can generate the prescription if we are skipping the these links like the presenting illness, physical examination, allergic details. These are not mandatory fields. Using the generate prescription, we can get on this page, we can get all the details, whatever details we have captured in the previous links, like the presenting illness, physical examination, allergic detail, diagnosis. These things we can able to view on the prescription page. The diagnosis, whatever diagnosis we have captured, the complaints, the general examination detail, the systematic examination detail, the local examination detail, and the allergens detail. Also here, the doctor can create the templates to generate prescription easily. So first of all, we will discuss about how we can create the templates to generate the prescription. Now we can see, sorry, for viral fever, I have already created one template in which I have included two medicines like amoxicillin and calpol and one test like liver function test. So for all viral patient, if since the viral patients, just we can order by selecting the viral template, we can generate the prescription with a short time. So not need to enter the medicine one by one, or if we not need to give the medicine for this patient, just we can uncheck it. If not need to give the liver function test, we can uncheck it and add another test, add another medicine to generate one separate prescription for this patient. If already we have generated the prescription for this patient, we can get the previous prescription details also. To create the template, we need to click on this create new template button. We have to enter the caption name through which we can able to select the name will reflect here. Whatever caption name we will enter, that will reflect in this list. From here, after entering the caption, we have to select the clinic. It will be valid for the all clinic or for the individual clinic. So clinic wise, we can define the templates. We can add the drugs. Drugs will be visible from the pharmacy. So by the group name of the drug, we can search the medicines available in the pharmacy. We can give the quantity here. Suppose that 10. Advice BD and add in the template. Same, we can search using the alphabetically or by the digits, and using the alias method also we can search the medicine name. The next is investigation. If we want to add some investigation for this template, we can select the investigation. Already these master data will be added, like the for under the biochemistry already I have added the medicine investigations, so that investigation we can select for the templates also by checking the checkbox and click on the save button. So one by one we have to add the information here. If any procedure we want to add for this particular template, so we can select the procedures also under the procedure section. So whatever procedures we have added under the OT procedures category, that will reflect here. So before creating the templates, these data are coming from the master data, whatever master data has been added by the hospital. Same, we can use the immunization services category and then any other services category. So after adding all the required details in the template, we need to save it. To saving the detail, actually I have enlarged the screen, so need to, so then we will get the save template button here on the right side, the bottom. Just click on the save button. We will create the templates. After creating the template, it will be visible here under the available template section. So let me generate one template. And also one things I have missed, that using the pharmacy, we can able to search the medicine also by enabling this service. There is a two types of service, like the medicines available in a specific pharmacy. Just click on the OK radio button. The system will ask for the to select the pharmacy from the drop down, whatever service stores or pharmacy we have created under the inventory module, that will reflect here. Just select the pharmacy and type the medicine name here. So we will get the drop down, the available medicine, the starting with the starting words. Just clicking, by clicking a double click on the medicine, it will be selected. Now need to give the dose and quantity here, or quantity. Then add the advice like BD, or sorry, OD for 5 days. And by default, as per the template, we have ordered the liver function test for this particular patient. Now we can already add the we have added the notes for this template that come after 7 days. So the notes are also coming. If need, we add the others, some more notes here, and click on the generate prescription button. In two format, we can generate the OPD prescription in A4 size or ticket size. As per the requirement, we can select. A4 size will contain all the details, whatever details we have captured, like the complaints, general examination, systematic examination, local examination, allergens detail, diagnosis, notes, whatever medicines we have ordered, prescribed, and the prescribed investigations. We can print the prescription and give to the patient. Now, for this patient, I have already created one prescription. So we can see the previous prescription details here also. We can print the previous prescription, and by selecting the previous prescription, we can do some change. If we want to remove some medicine or add some medicine on the existing prescription, we can generate new one. If the doctor wants to give the same test again after, while next follow up, so using the previous prescription, we can generate new one with the less effort. So now we come on, we'll go for the next link, patient progress report. Using that link, for the individual patient, doctor can view the progress report of the patient, like the symptoms, whatever symptoms we have captured, using the treatment, using the parameters, and it will comes under the patient treatment details, the history of the patient, the general examination, systematic examination, local examination, the regions detail, the diagnosis, and also the vitals. Vitals can be seen in graphical representation. So there is a different tab for the body temperature. We can view the graphical representation for the body blood pressure, for the pulse rate, for the respiratory rate, for the health rate, for BMI. We can get the graphical representation. Whatever investigation we have given, it will contain all the history of the patient. So doctor can view the previous investigation, and if the report has been prepared by the lab department, so after verification we can get the view link here to view the report. We can view the already ordered procedures here. Whatever medicines we have prescribed using the pharmacy, so we can get the medicine details here also, and how many medicines have been dispensed by the pharmacist, that quantity also reflect here. So doctor can see how many patients, how many quantity the patient got from the pharmacy counter. Any other services if we are given for that particular patient, we can get the details also. So from here we can get the total details of the patient progress report under the patient progress report. Then the next link is OPD service entry or advance order entry advance. So we can use the order entry advance. It is the latest feature. So from here we can get the view of the report, view link to view the reports, lab consolidated report link to analyze the previous reports results with the new one, and also the doctor can view the status. Currently it is showing active, but after taking the sample, the status becomes will show the sample collected date and time. Once the report will verified, then the status will change as a verified, and we will get the view link under this report column. Let me show you this part also. So once the doctor has been ordered the services and investigation, patient will goes to the laboratory sample collection center to give the sample if any investigation has been ordered by the doctor. So for that we have to open the lab technicians, or the, sorry, sample collection users will open the lab module from the home page. So now the session has been expired, so I have to log in again. Same process we have to do for logging. Then click on the login button, then enter the password and the captcha. Click on the sign in button. So now from here I have to open the